We're also reporting the most recent figures for patient homicide. Those figures have fallen over 10 years, and in the most recent year of 2015, we are aware of 45 patient homicide cases in England. So the numbers are coming down, but we also report two findings that are relevant to the stigma that sometimes goes with patient homicide. We found that it was very unusual for patients to commit a homicide unless they also had a drug or an alcohol problem, suggesting it's the substance misuse that leads to the homicide rather than the mental illness itself. And when those patients come before the courts, we found that quite often they still went to prison despite the fact that they had a mental illness. In the case of patients with schizophrenia who were convicted of a homicide offence, that figure was 41%, going to prison instead of hospital for treatment. We also found an improvement in the figures for self-poisoning by opiate drugs. That's the commonest type of drug taken in fatal overdose. Sometimes those drugs are prescribed, sometimes they're available over the counter. They're used in the treatment of chronic pain, and we are concerned that sometimes patients keep them at home and then they're available when the person gets into a suicidal crisis. So the message is one about safe prescribing in primary and secondary care, and a reminder to clinicians to ask what drugs patients are storing in their bathroom cabinet.